Up first will be Jason Andrasco with Carestream. They're also participating in our new learning lab in the exhibit hall. Jason.
Good morning, everyone. Joe Andrasco, sorry, I think I sent that information in wrong, but today I'm going to talk to you about Carestream's digital implant solutions and restorative hardware and software. We refer to these products as CS Solutions as an umbrella name. Specifically, I'm going to talk to you about prosthetic-driven implant planning, and I'll explain what that means and kind of go through the whole process with you. However, the purpose of our hardware and software is really to allow you to digitally take images and plan implant placement and restorative work. And what are the benefits of doing that? Well, really the benefits of doing digital planning are being able to communicate it with the patient effectively and being able to have the highest resolution and quality tools at your disposal to actually do that planning. And what this does is it gives both you and the patient confidence. It gives you confidence because you have the best products backing up your work, and it gives the patient confidence because they can see your plan from the beginning through the end. So what are the benefits? Well, we talk about more reliable diagnostic abilities. I'm going to talk a little bit today about cone beam 3D imaging and digital impression systems and how those systems work together. But 3D imaging obviously is able to provide you with a much better plan for implant placement and for surgical guide creation. That leads to more optimal treatment results. And of course, this gives you more confidence that you're giving the patient the best result possible. Being able to communicate it with the patient better increases case acceptance from the patients, of course, and obviously increases their satisfaction as they get a good result with faster healing. So what exactly is prosthetic-driven implant planning? Well, traditional implant planning, you would place the implant and then of course you would restore it with an abutment and a crown, and you would do your planning sort of in that order. Where do I have enough bone to place the implant? Okay, it goes here. I'm going to place the crown on top of that as best I can. Well, with prosthetic-driven implant planning, the merging of the cone beam 3D data with the digital impression data from a system that takes those images allows you to place the crown first and look at where the proper position of the implant should be from a prosthetic perspective instead of just from an anatomical perspective. So what exactly does it do? Well, you can see here it combines a cone beam 3D image, a digital impression image, and it allows your implant placement and fabrication from that point. In our suite of products with CS Solutions, this is built on our digital impression scanner first, of course, taking a good image. We have two digital impression scanners. The CS3600 is the newest scanner that we have. We launched that last year. It's a scanner that can take a full upper-lower arch scan in about 2 minutes or less, and it's one of the most accurate scanners on the market, providing you with the best possible image. The CS8100 3D is our most popular cone beam 3D. It's able to go from a focus field 5x5 all the way up to an 8x9. So no matter the size of the implant case that you're working on, whether it's a single implant or multiple implants across the arch, you can use the 8100 for both of those. Our CS 3D imaging software is what allows you to view these images, and then the prosthetic-driven implant planning module is what allows you to actually place the crown and merge the data together, and we'll see some images of that coming up here soon. So basically, in this entire process, the complete process for placing and restoring the implant, everything will start with a scan and a diagnosis. We'll move on to a 3D planning phase. Excuse me, I have something in my throat this morning. 3D planning phase, and then we'll move on to the placement of the crown and the implant, and finally, the restorative work. So with scanning and diagnosis, the first thing that's important with placing an implant, doing a surgical guide, of course, is getting a good 3D image. As I mentioned, there's a wide range of fields of view that allow you to do any type of case, whether it's small or large, but it also gives you the best possible view, clear view of how much bone volume, bone thickness, bone density you have, and where the mandibular nerve canal is, where the sinuses are, to make sure that you're clear of any anatomical structures that you need to stay away from. The intraoral scanner itself obviously records the soft tissue, as I mentioned, extremely quickly, very accurately, and it lets you get away from traditional impressions. The good part about digital impression systems, and particularly ours, is that you're not just limited to implants. If you want to do restorative work, limited orthodontics, and on and on and on, anything that you would be taking an impression for, excuse me, short of a full denture, you'd be able to do with the digital impression system as well. Alternatively, with Carestream's cone beam system, you can actually take a physical impression and you can take an X-ray of that, and you can use that X-ray data along with the cone beam 3D data instead of using a digital impression system. So if you're not quite ready for digital impressions, but you're interested in cone beam, that's another route that you can go. So after the scanning is done and you take your cone beam image, you take your digital impression, you can see here that the digital impression is merged with the CBCT scan. In our prosthetic-driven implant planning module, this is done automatically. So some other softwares, you might see that you have to select landmarks that correspond on the digital impression and the cone beam to merge those together. With ours, it's done automatically for you. You plan the implant, like I said at the beginning, with the proper placement of the restoration in mind. So here you have an overlay of the digital impression data on the 3D, and you have your virtual crown in place. And you can place your implant based on that. As you can see here in this image, the nerve canal is marked clearly in the cone beam, so we're assured that we're clear of that area. And you'll see a real case a little bit later with some of the X-rays that show this a little better as well. Carestream's cone beam software also has a large implant library with over 60 manufacturers worldwide, so you can create and manage all of the implant placement from your favorite implant provider through our software directly. So once you have the crown placed and once you have the implant placement in mind, the important part here is how do I go to guide from this? Being able to do that planning all in one in our software, at the end of it, you'll be able to click once and export that plan data and import it into a variety of other softwares that do surgical guide planning. So the surgical guide fabrication is done from the DICOM and STL data. Also in our software, you can see an image on the bottom right here that shows you how you can one-click generate a report that gives you a powerful communication tool for both your patients, your implant coordinator, if you're sending to a referring doctor, that lists all of the implants that are in the image, gives you a comprehensive view of the implant placement. So once you have the surgical guide, the next step in this process obviously is doing the restorative work. Traditionally, if you had an implant, you were doing restorative work, you might do an impression with an impression coping. Well, in the digital world, we call those scan bodies. So in the image you see here on the screen, the implant is placed and there's a scan body that's digitally scanned, and this is sent to the lab. The lab uses this data to extrapolate the position of the implant because they're only working off of visual data, they're not working off of X-ray data. But what this allows them to do is know the exact precise placement of that implant so they can produce a custom abutment and the restorative work off of the information that you've sent them. So this just recaps: scan, merge the data, plan your case, export to guide, and then do the restorative work. And that can be accomplished all in Carestream CS Solutions platform. One of the best features of our software is that it's open format STL, also exports to PLY and DICOM. So that means you're not limited in your choices of software or lab that you'd like to use. Our software is compatible with 3Shape, Dental Wings, ExoCAD, and a variety of other third-party softwares that accept open files. So you're not really limited, you have a lot of flexibility in what you can use. If you want to communicate with other doctors or if you want to communicate directly with anyone else using either a cone beam image or one of our digital impression systems, we have 2 pieces of software that are free that you can distribute freely. You can download them from our website that allow you to share your either digital impression or X-ray case with anyone you like. I'm going to go through one case here pretty quickly. This is an anterior single implant supported restoration on the maxillary lateral incisor. So you can see here, missing maxillary lateral incisor. We take a cone beam image, we do measurements along the bone to make sure that we have the proper width and depth and that we're not intruding upon the sinus. We take our digital impression, we overlay that with the cone beam data that we have. We place the crown. Of course, this is the prosthetic driven part. We place the crown first. Then based on that, we already did the measurements, so we know the size of the implant that we can support, so we place the implant there. Most importantly, we can get transaxial cross views of the implant placement to ensure that the prosthetic result that we wanted to achieve is there, but also to ensure that the implant will be viable and will be supported. Surgical guide fabrication created here. You can see the implants placed. Scan body scan is done. The temporary is, in this case, it was created by the lab right there the same day, and that placement was loaded immediately. So Carestream CS Solutions products really encompass this full workflow of allowing you to take cone beam data and digital impression data together for a great aesthetic result. So come see us at booth 1525 to answer any questions for you. Thank you.